This hospital is really nice. This was the bridge to get to the surgical children's part of the hospital. So yeah, we're cool. How are you feeling?
Good morning. I feel fine, and just waiting for this process to end, so you don't have to go through these type of excessive surgeries again. But I feel very confident with the doctor that you are and have had surgery on it for the past several years is very good. So I'm very confident about that. And just looking at how you carry yourself, it seems like you're confident. So that kind of calms me with my thoughts. So I'm just happy that this is coming to abrupt end. So.
How are you feeling?
Actually, I feel pretty fine. I feel pretty good. I feel pretty confident. At first, I was a little nervous. Still a little nervous. I think you're always nervous, just because the fact that it is surgery. A little anxious, waiting for it to be over with. So feeling all sorts of emotions, sad, happy, and that's really the way that I feel. A little sad and happy, but happy on the more front because this is coming to an end of all of the surgeries. So it's almost over.
Yep. This picture was taken in pre-op. They did my IV like right after this, but that didn't take too long, and then after that they took me into surgery. So yeah.
Okay.
Wait, how long has it been since the surgery?
Since 2 o'clock. It's almost 10
10.
o'clock
It's
now.
almost 10 now.
So you got 7 minutes. It'll be 10 o'clock.
Well, I had the surgery, and this is the first time I've really ever experienced pain. So I just went ahead and took some pain medicine. I was a little nauseous really every time I sit up, but they gave me some more pain medicine, so that's been getting better. I've been having headaches, but the ice helps. And they just put some ice around my jaw, really my whole face, but that feels better. I really just want to go to sleep, but yeah.
What is your pain level at now?
It's at an 8, but I feel like it's going down now.
Between the ice and the medicine?
Yeah. If you take this off, it's gonna shoot back up. I can feel it.
If we take what off?
Like if all this was to come off, the pain would shoot back up.
Oh, okay. You went to sleep for a while. Were you sleepy or?
Well, I mean, they gave me anesthesia and those drugs. And I
No,
was-
we just mean just about an hour ago you did get a little nightmare.
I mean, I was just trying to get rid of the pain. I didn't want it to stay up.
Okay.
And it was light. I didn't want it to be dark like it is now. And I used a little sleeping music to go to sleep. So, yeah. I'm hungry.
Yep, we are
I
too.
don't think I can eat anything yet. It hurts to talk, but here I am. Talking.
Well, we're gonna be hungry right along with you.
Yeah, I can eat this.
No, we're not. No, we're gonna sit right with you.
Okay. Turn the camera around so y'all. Okay.
So right now, like we were saying, I was really surprised. We were both surprised that she wanted to do this now. But she's in a lot of pain. But Kyton has always had. She's always had a very high tolerance for pain. And her head is killing her right now. So they just gave her some higher dose of medicine, Oxy, that you had to take through the liquid form. So, like I said, I was just pretty shocked that.
I think it's just a question of her resilience. Something even her doctor stated that normally through all of her situations that she bounced back pretty quickly because of how resilient she is. So once again, she has showed again from her trying to show this video now her resilience and just how she can pivot her pain to do things in a powerful, positive manner. So,
Yeah. But everything went very, very well. Dr. Pauly, he came out and talked to us. He talked to us in interviews, and he said the process went great. And like I said, it's a lot to do with Kyton and her recovery and so forth, that she always does well with that. And he was very detailed, and I know Kyton will show everyone how it goes. It's going to be very detailed. This is just the first process of the halo being put on. But at the bottom, you'll see in the wires, he showed us that that's going to have to be screwed on by her orthodontist. And that we're going to get that done in Chicago. He said it needs to be done
next week.
Yeah, next week. Next week. Very intricate. There are certain screws and.
Tell them why we're in Michigan.
While we're in Michigan?
So why? We're in
They
Michigan.
don't know why I did surgery in Michigan.
Oh, the reason why we're in Michigan is because this is where her doctor resides. He used to be in Chicago, but he moved to Michigan for various reasons. I think one of the biggest reasons was he has more freedom to really do things with his patients possibly than it was while he was in Chicago.
Yeah. And we were going to follow him wherever he went.
Wherever he
we were
went.
just talking about that. We were just saying at least it's in the Midwest.
Right.
And when Kyton used to go to school in Louisiana, that would have been a bit more difference, but we said we don't care where it was. We were going wherever he went.
Yep.
Whether it was Texas, other
It could have
side
been
of the
Mexico.
world.
Yeah.
Yeah, we would have been there. So we're very confident in him and his work. He's traveled worldwide. He has coined techniques, invented techniques, and I think Kyton has been a part of some of those techniques that he created. But because of our, trust in him, I'm glad God led us to him. So we're gonna go wherever he goes.
Matter of fact, that's even how I met him. I used to work in a hospital, and one of the nurses told me about him. And ever since then, he's been in a couple of places and movies downstairs. So.
Right now, I feel better. A little bit earlier, I was like, "Oh wow, I didn't know," because this is the first time that you really kind of
The blood and stuff. I
yeah,
never
like you reacted,
experienced.
huh?
I never felt like that after surgery.
Right, that's what I mean. That was the first
You
time.
usually turn down the medicine.
Out of all, yeah, that's what I was really
That's
shocked.
it.
You
You
usually
turn down
don't
the
even
medicine.
take pain medicine, but now you're taking it. But I remember you had mentioned before that
It's a whole different pain.
it's a whole different pain. You kind of
Yeah.
had predicted this, so. But I didn't like you. You vomited a lot of blood out, but I know that was from the surgery
Yeah.
too.
Yeah, that
So-
seeped into your stomach. And,
That was a little hard to
and
look
that's
at.
that's
Yeah.
what made you nauseous.
Yeah.
But you asked us how we're doing. I mean, that's what's hard is just seeing you go through this pain.
Yeah,
I
that's what I
mean,
mean.
what we're going through now is watching you go through the pain. That's what's
Right.
hard.
But I'm glad you started to feel better
Yeah.
from, 'cause I know you were, I knew you were, well, you
Yeah.
didn't want to pick up the phone anymore and the lights out, but
It's kind
You'll
of
get better.
irritating.
I know.
Yeah, but look at you now. See, this is part of what you do. Even when you're in pain, you still wanted to record this. So this is these are things that you do
So,
time in and time again.
if
Now
I
you're
was somebody else's kid and it were other parents, what would you suggest to them to get through this?
That's a good question. I mean, just doing what we're doing. Just be by their side and try to promote them to have confidence in themselves and just take note to the things that you're doing. Try to, whatever happens with them, try to turn that around and help somebody else because they probably need some help. I'm on a couple of cleft palate sites and people are always asking, well, what is your suggestions? Somebody tell me what can I expect. So
This is also different because I think everybody's surgical experience is different, so this might not happen to everybody. But
yeah, but some things gonna be similar.
yeah.
You know,
Just tell people, number one, you have to stay prayerful and you have to be strong for your own child, you know, because sometimes I want to cry, but I don't, you know, because I know that I have to be strong and I know that you're going to get through it. I always see light at the end of the tunnel, and I would just tell someone you have to stay positive. You definitely have to stay faith in God and know that this will pass. You know, everybody has to go through different things to get them to where they want to be. So I just know it's light at the end of the tunnel. I know it's challenging, but you stay strong and you accept it as a part of life. You know, sure, it does hurt to see you go through this, but I know that God wouldn't fail us. So I would just keep that encouragement and keep encouraging and really tell them, you know, to admire their child, you know, because all of the strength and endurance, because it only makes you stronger and it's preparing
exactly
you for life.
But
You know,
this is life.
it's
You
a
have
preparation for life and what you do. So take it really as a gift, a learning experience. It's, you know, not a hindrance, but just something that you go through to make you stronger, your child stronger, your family stronger. So that's just, you know, the way that you have to look at it.
It teaches you how to adapt and overcome.
Okay.
From your
So
personal situation to somebody else, you know, through this situation.
how do you feel now, Peyton? It's like the third day.
I wasn't supposed to be here this long at all. I'm ready to go. I'm leaving today. It's not the plan. I'm leaving today. I guess I feel better.
Speak up.
I guess I feel better. My mouth is still kind of sore. I mean, as expected. It's just my head. I ain't getting bad headaches. But the washcloth helps. The cold washcloth helps. But like you said, you have to find what helps your pain. So whatever it is, you should do it. But they said they wanted me to stop using the cold compression, so I guess I'll do that when I get home. Being in the hospital is very irritable for this long. This is the third day. I feel like I've been here for a week.
What do you mean? Because they always come in and they ask
Yeah.
you questions.
Why is it irritable?
Why?
Why are you irritated?
I just know I'm supposed to be at home. I'm supposed to be here in the third day. It's irritable. I don't really. Well, yeah, they did wake me up a lot. And it was hard to like find a comfortable spot to sleep. Like it was just irritating them for them to wake me up and check my vitals. My vitals have been the same. So there's nothing wrong with me. So that was irritating.
Well, what about the pain medication that they're giving you? Do you find that one works better than the other?
The only one that really worked is the Dilaudid. And that works because right when they put it on the IV, I feel it going through my body. And then like everything just goes numb. Not numb, but I don't really feel the pain. But the Motrin and the Tylenol, it really doesn't do anything for me. So, but in order for me to leave, I can't get any more narcotics. So, I'm not gonna get any more narcotics. I'm eating, but I don't really have an appetite. I'm trying to eat. And I only eat a little too, like I couldn't finish that milkshake even though I wanted to. For breakfast, what did I get? I ordered some scrambled eggs, so I'll see how that goes. But yeah, I'm just very irritable. I don't feel like talking to anybody.
But yeah, the surgery went well. This is my surgeon, and if you guys have any questions, please ask. Bye.